Welcome back to the Chad Hasty Show on News Talk 95.1 FM and 790 AM KFYO. Thank you for tuning in today. Joining us on the phones this morning, former White House physician, also a Republican candidate for the Texas 13th Congressional District, Dr. Ronny Jackson, joining us here on the Chad Hasty Show. And good morning, sir. How are you today?
Good morning, Chad. Thank you for having me.
Yeah, absolutely. It's great to have you. And I should also mention Level End native. I mean, you're West Texas. Yeah, welcome. Glad to have you on.
Thank you. I appreciate it.
Yeah, absolutely. Let's talk about the coronavirus. Obviously, that's the issue dominating the news. Yesterday, the president of the United States holding basically a 2.5-hour press conference on this. What was your takeaway from that press conference, the numbers that we're hearing about? And for those who don't believe that the coronavirus is that serious of an issue, what's your response?
Well, I think it is serious. You know, we just don't know how serious yet. I mean, it's on a spectrum right now that we don't know if it's going to be on the low end or the high end. I think the president's doing everything he should be doing right now. He's preparing the country for the worst, and obviously we're all hoping for the best. But it's his job as the commander in chief and as our head of state to prepare us for the worst, and he's doing a very good job of doing that. He's surrounded himself with great people. I mean, HHS, Secretary Azar and Brett Giroir and Anthony Fauci, all these are physicians that are in different fields, but at the very top of their game and well-respected. I know all these people on a personal level. It's a great team he's put together, and they're working super hard to collaborate. I mean, the one thing the president's done that's a little unusual is the way he's brought the private sector, the government sector, and the academic sector together to collaborate on this and come up with a solution. And then all the money that's been dumped into solving this, that in combination with what I would consider just his ability to just spark American innovation and kind of tap into the private sector genius, I think is going to get us out of this. But I think he's doing the right thing. He's being cautious and making sure that we're prepared.
Well, and one thing that I've been impressed with, and it doesn't seem like the national news media has been as impressed with, is the amount of businesses, private sector businesses, that are coming together on this and saying, we're going to change up our business model. We're going to stop producing what we're producing, and we're going to make ventilators. We're going to make masks. We're going to make whatever, gloves. We're going to make whatever our doctors and nurses need. And I mean, this has really been a nationwide effort.
Yeah, it's phenomenal. I mean, if you look at all the people that are doing this, you have clothing companies, like Ralph Lauren and Under Armour. You have all these automobile companies, Chrysler, Ford, GM, building ventilators, masks, gowns, just anything you can think of. Going into mass production, you have, I think, Anheuser-Busch and some of the other folks that normally produce beer and alcohol and stuff are now just making hand sanitizer by the thousands and thousands of gallons. So everybody's really pitching in. I think it's a time, people are worried about their personal income right now. A lot of people have, lost their jobs right now, and I know that's really serious, but I think we can also be inspired by the fact that the country's stepping up and coming together on this in a big way, and I think it just speaks volumes about who we are.
From what you know about the coronavirus and COVID-19, how is this different than the flu? Because, one thing that and I'm sure you've heard it. Others have talked about this. Is it really that bad? Is it really any different than a cold or a flu?
It is, and the reason is, first off, we don't know how different it is than say the seasonal influenza right now, because we don't have the data right now. We don't really know how infectious it is. We don't really know what the mortality rate is. Although I'm a firm believer that when this is all said and done, we're going to find out that it's a little bit more infectious than the flu, and its mortality rate's probably going to be a little bit higher than the flu, but not much higher. I think by the time we find out how many people actually have it, don't know they have it, or have it and had minor symptoms, we're going to see that denominator is huge, and I think the mortality is going to be close to the flu, going to be close to 0.1%. We'll wait and see. What makes this dangerous right now is that it's a novel virus. Whereas we have an established vaccine for influenza, and some people get that, and that vaccine's, anywhere from 40 to 60% protective. It provides a little bit of a barrier in the walking population of people walking around that have been immunized so that the flu doesn't spread as rapidly as it would otherwise without the vaccination. The other thing for the flu is that we have medications to treat the flu. If you get the flu, we have Tamiflu and other medications that can mitigate, and treat you once you get the flu. We don't have either one of those for this virus right now. We don't have a vaccine, and we don't have a good treatment available right now. So that's what makes it different. That's what makes it potentially more dangerous. Now, they're working hard right now. I mean, they are coming up with all kinds. I get calls every day because of my association with the White House, because I was the president's chief medical advisor at the White House for 3 years, and I worked side by side with the president and the members of the cabinet for the last 3 years. So I'm getting lots of calls every day about new creative ways to approach this, on vaccine development, on medications that people think should be used. But there is a lot of stuff going on right there. There are multiple companies out there, NIH and Johnson & Johnson and all kinds of other, pharmaceutical companies that are working on developing vaccines. And there are tons of medications right now that are being looked at that are already FDA-approved medications. So that'll really expedite the process if we find the one that works, because we're already going to have human safety data on it. It's just going to be a matter of determining whether or not it works on the flu. And those are being looked at right now, too. So there's a lot of stuff happening right now. But I think in the meantime, we need to follow the president's advice and the CDC guidelines and just continue on the path we're on right now.
Visiting with Dr. Ronny Jackson here on the Chad Hasty Show. We see the numbers in New York City and coming out of New York, and it's not pretty there. It's a bad situation in New York. Not every single metropolitan area, big metro area, is looking like New York right now. Is that likely to happen or unlikely to happen in your opinion?
I think, it's unlikely that everybody's going to look like New York. I mean, the demographics are different, and just the structure, the way it's set up. I mean, you've been to New York probably. You go there, they live on top of each other. I mean, literally, they all live in sky rises there, and they're packed in pretty tight. It's not that way in every city. Now, there's a lot of cities that are like that, but, for example, in the area that we live in Lubbock and Amarillo and in this area, it's not like that, So I think that we have a better ability to maintain social distancing, and continue to carry on with certain normal activities than people do in large cities like New York, where they really rely on the transit system too, on the subway and on cabs and things of that nature, and not so much for us.
But when you compare like let's say a Dallas or Houston to New York City,
I think it's still the same thing applies. Dallas, is spread out a lot more than New York is. I mean, There's the downtown area, where there's some big buildings, but in general, Dallas is spread out over a massive area, and New York is huge too. But it's also vertical. I mean, it doesn't matter where you go in New York. It's high-rise buildings everywhere. That's what they work in. That's what they live in, and they commute with each other in large groups to get from point A to point B, and that's where I kind of draw the distinction. So we don't need to take this lightly. We need to continue to, I think, assume that it could happen in Dallas the way it's happening in New York and places like that. But I think we're structured better that it's not as likely. Plus, we have a head start on it. A lot of people in New York had it before they even knew that this was going to be a problem, and it was already spreading before people started getting clinically sick with it. We have the advantage of seeing what happened in New York and potentially stopping it before it even spread.
Before I let you go, I know the CDC is now debating whether or not to tell Americans to wear masks. As a physician, what would you tell people? What would your recommendation be?
Well, there's always been this debate about, does a mask make it worse or better? And I've always been a proponent like, hey, if you have a mask on your face, that's going to prevent you from touching your nose and your mouth as much as you otherwise would, because we just unconsciously throughout the day reach up and touch our face, particularly areas around our eyes, our nose, and our mouth. Well, the early argument they had was like, well, if you wear a mask, you're going to be constantly fidgeting with that mask, and you're ultimately going to touch your face. I don't think that's true. I think that if you are around folks that are sick, or if you're really worried about this, wearing a mask is not a problem. I think that anything that provides a barrier between your hand and your nose and your mouth is probably ultimately going to help you stay well.
So a mask is more about you touching your face than it is you're walking in a grocery store and you're walking by somebody.
I 100% I agree with that. Now, if you are sick and you're coughing, a mask prevents you from coughing those droplets that potentially infectious onto other people. So if you're sick, it's a different story. But if you're healthy and you're trying not to get sick, I think the real value that a mask brings is limiting your touching your face and your hands to your face, specifically your nose and your mouth, more so than breathing in any contaminated stuff, especially if we're doing the social distancing and we're staying a few feet apart from each other. There's not near as big a risk for that. So it's really the hand to face contact that it limits.
Dr. Ronny Jackson, we appreciate your time. We're going to visit again soon on more of the political side of things in the future. We're glad to have you on, and we wish you the best of luck. Stay healthy, and we'll visit again soon.
Thank you, Chad. Appreciate it.
Absolutely. That's Dr. Ronny Jackson here on the Chad Hasty Show, former physician to President Trump in the White House, also candidate for Congress.